our clinical education to our students. In the past, it had provided nursing programs a way to sort of like address and close gaps in nursing education. But then again, I stress that at this point in time, this may be the only way to provide their clinical education for our students. So with that said, today then would be a good time to kind of like reflect on where we are and what are we doing with our virtual simulations, especially debriefing. And in relation to debriefing, let's talk about what are the standards of debriefing in virtual simulations, and that what are the effective ways to debrief virtual simulations, and if there are challenges, how are we going to face these challenges and make our clinical education, at least for the time being that we have COVID, successful. So again, there's no argument here, right? As simulation educators, we are one in saying that debriefing is a very critical part of simulation-based education, and that it is a critical conversation following a simulation to reframe the context of a situation, facilitate students' reflections, assess critical thinking, evaluate learning, and improve future performance. The question is, how do we effectively debrief following immersion in virtual simulation? So, traditionally, even in in face-to-face simulations or in-person simulation, there are different debriefing formats. In-person debriefing is, of course, our known gold standard of debriefing. It's what we know. Self-debrief is also not unheard of. It is usually done as a self-reflection submitted to our learning management system or emails, um, where students answer the same debriefing questions after immersion in a virtual simulation. And then, of course, what is emerging as a new format for debriefing, although it's not uncommon, people have used this before, is the virtual debriefing format. It's the same process as in-person debrief, but through a web-based conferencing platform. Now, there are interesting studies by several researchers, mostly studies from a group of nurse educators in Canada. And they studied the effectiveness of these three types of debriefing format, both in-person simulation settings and virtual simulation settings. And they found that all types of formats led to positive outcomes when they measured, measures of success in their studies. A lot of times their outcomes are self-efficacy, success of the debriefing experience, of course, increase in knowledge. Those are the common measurement or outcomes that they have been measuring, I should say. And the interesting thing is that they found that all of these formats led to positive outcomes anyway. However, they found that self-debrief led to lower scores on their intended outcomes, and that the in-person group debrief and the virtual group debrief had no significant differences, although they found that the group that were in the virtual virtual learning environment format of debriefing, example, web-based conferencing platform such as Zoom, yielded slightly higher scores in their intended outcomes. So what would be the implications for us here? Well, disclaimer though, we still don't have enough studies to say that, oh, those findings are evidence-based, but we can kind of like have hope from this initial data, and that this data may somewhat guide us in what we're currently doing, right? So it gives us hope that, well, we're not doing things that don't make sense at all. We do have initial data that shows that, yes, these are effective ways of debriefing, not just in face-to-face environment, but in a virtual learning environments as well. And then let's talk about debriefing virtual simulations then in an online conferencing platform. So nowadays we live in the world of Zoom, right? Like we're doing right now, and the studies, very few though, we would say not a lot of studies done here, some studies, and interestingly, the studies on virtual learning environments have started around, I guess, 4 years prior to this year. So the the virtual learning environment and simulations in virtual learning environments have already been done and embedded in some nursing curricula. But again, nowadays we know that this is what we do. But what they're saying is that debriefing using an online conferencing platform is effective. And it is effective when done with of course, using the standards of simulation education, such as the use of a theory-based debriefing framework, and that it follows the phases of the debriefing session as recommended, which would be setting the stage, and of course, the body of the debriefing session where we do all of our reflections, transfer of information, abstract conceptualization, and so on and so forth. And then finally, a summary. So what the studies are saying is that, well, debriefing simulations in online conferencing platforms are as effective as in-person debriefing if we follow the standards of debriefing simulations. So other studies also there are showing that we can combine uh, formats, especially in virtual simulations, so that self-debriefing really offers an immediate debrief after a virtual simulation. And again, uh, from our experiences with virtual simulations, we give our students a certain amount of time to complete them. However, they can vary. The students' time of completion of virtual simulations can vary. So we also know the value of debriefing the simulation experience immediately after they experience it. It's really that the shorter the amount of time in between the simulation experience and debriefing, the better. And so what do our students do then while waiting for the time that we're supposed to meet them for that group debrief? So they found that there is value in having our students actually do a self-debrief by answering reflection questions that they can use to um, gather their thoughts and make sense of the experience. And with that, they bring that to the group debrief and they're better prepared. So with group debriefing, that would further extend students' reflection after the self-debrief. So that what our studies are showing is that combining debriefing formats can be an effective way to debrief virtual experiences. And with all of this being said, we have to kind of like explore what are the faculty roles and responsibilities in a virtual simulation world, and what are the expectations from students as well. So, well, we know this and we repeat this over and over again. In order for debriefing to be successful, it must be facilitated by someone trained and deemed competent in debriefing. Now, I know that many of us do have dilemmas about debriefing nowadays. Now that we are limited in our ability to provide clinical education for our students, and we're doing virtual simulations as our clinical experience, many of our clinical instructors then who probably have not had any education or training on simulation, let alone debriefing properly, will now have to debrief their clinical groups or the simulation experiences of their students. And then again, repeating myself here, the debriefer have varied roles throughout the process, and the process would be 1, 2, 3. We have to set the stage, and this is very important because we're setting our safe container here. We're trying to direct the experience to where it should go. And then of course our skills at debriefing will really come to life when we go through the um, experience and making sense of the experience and allowing our students to reflect and so on and so forth. And then how to kind of like summarize the experience in order for the students to be able to uh, have a review of the lessons learned and how it would be incorporated in practice. And then finally, how do you close the session so that you solidify the learning experience? And then again, looking back at our standards for debriefing here, of course there are several, but what comes to mind most of the time is that number one, the training of the debriefer, and number two, the use of a process that is based on theory based framework. And our previous experience last semester, for example, when we were thrown into a situation where we had to kind of like uh, provide a clinical experience for our students in an emergency mode, um, many of us are reverted to the facilitation of simulations, or most especially debriefing, that is not theory based, although we have always advocated, at least in our program, that we are using DML. But when COVID happened, it's almost like we forgot how to do DML. And again, there are many factors to that. The transition to a remote structured environment, the use of online conferencing platform maybe have thrown everybody off, well, among other things that had happened previously and are still happening right now anyway. In this process, our students are expected to participate actively. They're expected to complete virtual simulation activities, and they are supposed to be engaged in group debriefs as well. Again, we need to identify what are potential barriers to active engagement of our students. One common barrier here is knowledge of technology. We are having them do a lot of simulation activities that are based on technology. Do our students know how to do this? Um, we want them in online conference platforms. Have we explained to them how to participate, or what are the tools to success in a virtual learning environment overall? Would be our a prime consideration here, and that therefore that would have to be incorporated in our overall plan for virtual learning or virtual simulations. So I was talking about potential challenges, right? So um, number one here in virtual simulations is the faculty is not present in um, the simulation experience. And therefore, how do you then facilitate simulation experience that you have not seen? Or how do you debrief uh, a simulation that you have not seen. Well, again, in our traditional world, as a facilitator of simulation, I'm watching my students get immersed in simulation. I'm noting points of action and inaction that I need to debrief with them afterwards. Now, in a virtual simulation, um, how can we do that and comply with the recommended standards or the standards by NACSL? Well, one thing that we need to do, and it's a must, is to review our students' performance transcript after the virtual simulation, and we note what were the actions that were taken, not taken. We actually have a very good view of the unfiltered review of each student's performance, rather. And in some literature, they actually see this as an advantage. A physical observer during a face-to-face simulation is likely
Raquel, we can't hear you anymore. So everyone just give Raquel a few minutes. I know she's having some Wi-Fi issues, and we had talked about this earlier. That must have been why she's either frozen.
Somebody's probably playing Fortnite now.
Yeah. Raquel, are you able to resume?
topic after we got disconnected or interrupted. I was talking about further considerations when debriefing virtual simulations. So we need to consider a number of participants per session. So if this is a virtually conducted debriefing, does that mean that we can have more participants? Not necessarily. So many of the studies are showing that it needs to be as small as possible, which is maybe 10 or less. And that is to maintain the engagement of our students. It would maintain our ability to connect with them more intently and purposefully, as opposed to a larger group, even in a virtual environment. And and then again, a careful consideration of when should debriefing session occur in a virtually conducted simulation or a virtual simulation. And the recommendation is that the debriefing session should occur um, as soon as possible after a session. And so therefore, in cases where we cannot meet our students right away, a self-debrief is recommended so that they get to capture their reflections of the experience right away. A good consideration of quality. So how do we maintain a quality of debriefing in virtual simulations? The same considerations that we need to do when we are debriefing in-person simulation, and again emphasizing on the ability of our facilitators or debriefers to facilitate. So therefore education is key. And then how do we then maintain quality even after providing education to our debriefers? There need to be constant evaluation. So evaluations of debriefing by our peers and by our students should be done in the virtual learning environment. And then again, we do this in in-person simulations, and it should be done in virtual learning environments as well. So careful consideration of formats. So we know that all of the formats work: in-person group debrief, self reflections, and virtual simulation debriefs. They all work. So what would be our consideration for the type of format that we need to select for our students. So obviously, in our current situation, we probably do not have much choice but to do group virtual debriefs. But we also need to consider the value of individual self-reflections or self-debrief there. Um, as studies also try to see if it's enough just to do a self-debrief, but they found that there are a lot of challenges there. There are, of course, differences in the ability of our students to self-debrief. Graduate education versus undergraduate education, level of the students in the program are all our considerations here. So although we have initial studies that can provide us guidance on what to do with debriefing in our virtual learning environment, there still needs to, we still need a lot of research and data really. And therefore, hopefully with everybody doing, or not everybody, and I'm sure there are some who do have other options, with our limited choice to doing virtual learning environment or simulations in a virtual learning environment, that we collect data and or perform research, conduct research, so that we can form evidence-based practice in facilitating virtual simulations, most especially debriefing. And so with that, I would end my presentation so we can, I guess, share our insights or concerns regarding debriefing in virtual simulations. I also included a list of some references at the end of this presentation if you are interested to review them. Thank you.